Welcome to The Explainer. So if you're over 60 and you find yourself waking up sounding, well, kind of like a bowl of Rice Krispies, with knees, hips, or shoulders that literally snap, crackle, and protest every single morning, you are in exactly the right place. Okay, let's dive right into this, because what we're going to uncover today is absolutely crucial for your daily comfort and your long-term mobility.
For so long, society has told us a very specific story about aging, right? We've basically been led to believe that morning stiffness and joint pain are just inevitable parts of getting older. But think about it. Is it just old age, or is it actually a warning sign? We need to completely reframe how we look at this pain. It isn't just a natural decline. It's a crucial biological signal your body is actively sending you. And sadly, it's a signal that way too many of us completely miss.
Which brings us to the absolute core advice from our source material today. It's a really simple but vital rule. Please don't ignore it. Look, I get it. It's so incredibly easy to brush off a nagging ache, to just tough it out, or quietly accept it as your new normal. But we absolutely have to pay close attention to these physical signals. Missing these warnings, that can lead to much bigger problems down the road. And honestly, you deserve to feel good in your body.
So how exactly do we decode these signals? Well, today we're going to uncover the 3 biggest silent reasons for this pain. But more importantly, we're going to look at the simple everyday habits you can use to actually fix them and reclaim your comfort. All right, let's jump right into it. Reason number 1, the natural loss of muscle strength. As we get older, our bodies naturally lose muscle mass. Now, what's really interesting here is how this actually works. Think of your muscles as your body's built-in shock absorbers. When the muscles around your knees and hips get weaker, those joints lose their primary defense system. Without that support, the joints are suddenly forced to take the hit and work much harder. That extra pressure is exactly what leads to the stiffness, the pain, and that reduced mobility you're feeling. On the flip side, strong muscles act like a protective shield. They support healthy joints and drastically reduce their daily workload.
But hey, here is the really great news. You don't need to suddenly become a competitive bodybuilder to build that supportive muscle back up. The solutions for immediate relief are actually just highly actionable micro-habits. We're talking about a simple 20-minute daily walk or just doing some gentle strength exercises a few times a week. These totally doable, simple steps are often completely enough to effectively support your healthy joints and take that terrible, grinding pressure right off of them.
Okay, moving right along to reason number 2, chronic inflammation.
So we're shifting gears away from the physical mechanics now and looking deep into your internal chemistry. You see, inflammation is often directly fueled by what we put on our plates. Sugary drinks, processed snacks, heavily fried meals. Yeah, these aren't just bad for your waistline. These really common dietary choices actively contribute to a destructive internal environment. Basically, they fan the flames of inflammation in your body, directly causing that awful morning joint pain you're waking up with.
But listen, you have tremendous power here. By embracing vibrant, healthy foods, we're talking colorful vegetables, fresh berries, fatty fish like salmon, grabbing a handful of nuts, and just drinking plenty of water, you can actively fight back. Making these small, totally manageable changes in your diet can dramatically support your overall joint health over time, actively cooling that inflammation right down. It's a real game changer.
And this brings us to our third and final silent reason, delaying action. So the crucial point is, how we respond to what our bodies are telling us is incredibly important. Ignoring persistent problems is, well, it's downright dangerous. We really need to clearly differentiate between normal, everyday aches and serious medical red flags. If your pain lasts for weeks, if it gets progressively worse over time, or if it comes along with swelling, visible redness, or severe difficulty moving, well, these are definitely not things you can just walk off or fix with a handful of berries. These are huge red flags that require speaking with a healthcare professional immediately. Simply put, early evaluation equals independence. Identifying the true root cause early on is absolutely the best possible way to get the precise treatment you need and ensure that you can stay active. The sooner you address an ongoing joint problem, the better your chances are of maintaining the exact lifestyle you love.
I want to let this really sink in for a second. Getting older doesn't automatically mean you have to live with constant joint pain. That pretty much synthesizes our entire core message for today's explainer. We are decisively shattering that old age myth once and for all. You have control. You have agency in this. Pain does not have to be your permanent roommate just because you've celebrated a few more birthdays. No way. To bring this all together, mastering the true pillars of longevity makes a very real, tangible difference. It's all about how these everyday habits work together. You combine healthy movement to keep those shock-absorbing muscles strong, with good nutrition to actively fight off internal inflammation. Then, you add in quality sleep to let your body heal, and maintain regular medical checkups to catch any of those red flags early. These are empowering, highly controllable solutions that basically guarantee better joint health and prolonged independence.
As we wrap up this explainer, I want to leave you with one final vital question to think about. Which small habit will you change today to protect your independence? Will it be taking that 20-minute walk, maybe swapping a processed snack for some fresh berries, or finally scheduling that doctor's appointment you've been putting off? The choice is entirely yours, and the power is completely in your hands. If you found this helpful, be sure to follow for more simple senior health tips designed to help you stay strong, active, and most importantly, independent.